Today we're going to talk about what to do if you have an extravasation. So the first thing you want to do is stop your fluids, stop whatever's running through that IV. And then at that point, you're going to want to remove the fluids from the IV site, but don't take out the IV line. The next thing you want to do is take a 10 ml syringe and hook that up to your IV site and see if you can pull back anything. If you can, try to pull back a full 10 mils, but go ahead and pull out whatever you can and then remove that. And at that point, you can take out the IV site. Once you've done this, you're going to follow the policy based on what medication was running. You can either look this up in Policy Stat or call the pharmacist, and they can let you know what the antidote is. So some common things that might be running that might require an antidote are potassium, your sodium bicarb, your 3% saline, or your Levophed. So we're going to use in this example potassium, which your antidote is hyaluronidase. And for this, it's a 1 ml injection. So you're going to draw up 1 ml of the medication. And then you're actually going to give 5 injections of 0.2 mils using a 25 gauge or smaller sub-Q needle. And what you're going to do is you're just going to use your alcohol swab on the site around the IV or where the IV was. And then you're going to give 5 injections around that site using a new needle each time. Okay, and once you've done this, you're either going to apply a warm or cold compress based on the medication. For this one, it would be a warm compress. And then you're going to put that on there for 15 to 20 minutes, at least 4 times a day. And you're going to elevate that limb for at least 48 hours, as much as possible. And then when you restart an IV, what you're going to do is try to go in the opposite arm if possible. If for some reason you can't, always go above the site, never go below your extravasation site. And then just make sure you document.